Private medical insurance. Is it really that much better than having public medical insurance? You tell me. Well, basically, I have some data for you. I've set up a couple of websites that we can look at, has a little bit of information. I am not from the UK, so I cannot speak of what is going on with the NHS and everything else. I am actually from a country that has obligated private insurance. That means that everybody in the country needs to have a private insurance. And I'm not talking about the United States. I'm talking about the Netherlands. I live in Spain for a couple of years now, but I'm originally from the Netherlands. So I can speak from my experiences, from what I know, from the system in the Netherlands and from what is going on in Spain. And well, let's look. I've got something here for you guys, a little bit more information, and then just let's take a look at it. It's information about basically all the different types of healthcare. You can see all the countries with the explanation of what type they have within their country. So I'm going to scroll down towards the Netherlands to see what they have over there. So over here you have the Netherlands. The Netherlands has the Bismarck model, which is a mandatory health insurance. There you can see it for everybody. If you do not have it, you get fined. If you do not pay even for 1 month, you get fined, and those fines are very high. So, and next to the private medical insurance, which you need to pick out like you would pick out your car insurance, I will show you in a minute, you would still have to pay extra deductibles and extra stuff. So there you go. So all the memes about Europe having free healthcare towards the United States. Well, within Europe we have not all free healthcare. There are some countries where you do need to pay significantly. Okay, so over here we have Spain. Okay, in Spain we have the national health system, which is like the UK, which has free healthcare for residents. So you have your padrón, you have your green card, your NIE, and everything. You have all the documents ready, and you are registered, living, studying, working, anything within Spain. You will receive free healthcare. You need to fill in some documents, and you will have your healthcare card. You can go to a doctor anytime, and maybe you might need some medication. You go to the pharmacia and you will need to pay maybe 1 or 2 euros to get those medicines. It's really low cost. It's really low. Of course, you can still choose to get a private healthcare. This is an option. It's not an obligation. You can just choose to do so. And the private healthcare in Spain would be around of a cost of maybe 30 euros for a family. Still very low cost, and then you can go to private hospitals, a little bit special, a little bit extra, and it's still not very expensive at all in comparison to what I am used to pay for healthcare within the Netherlands. So it's still very, very cheap. In my opinion, the free healthcare system that Spain has, it has clean, modern hospitals, patient staff that really do try their best to help you, even if you do not speak Spanish. Although, in all honesty, the public system does not have any medical staff that actually speak English or actually speak other languages. For that, you need to get a private if you prefer that. But then again, even if you do not speak Spanish, they really do try to communicate with you in the best way possible to help you out. Clean hospitals, modern hospitals, patient staff, and so yeah, nothing wrong. Okay, so over here you have the United Kingdom, just for reference. As you can see, it's just providing free healthcare for residents and citizens, and etc. You know that. So This is one page of information. Over here, best healthcare in the world 2023. You see that Spain is really not doing bad at all. If you can see, it's 0 to 20. In the Netherlands, the same. UK is doing the same. We're not bad at all. We're just doing good. And if you look at the list over here, Spain is actually number 8. So they have the explanation over here of how they calculate everything. But you can see Spain is number 8. And the Netherlands is not even on the list. United Kingdom is at number 10, which is same as Spain, free healthcare. The Netherlands is number 11. So even though all private healthcare in the Netherlands, it's actually lower ranked than Spain and the United Kingdom. Over here, another website is also Healthcare Index by country. You can see Spain, again, is not doing bad at all, 77.91. And over here, a marking of 77.08 in the Netherlands, and the United Kingdom, 74 and 13. So definitely not doing bad. Spain is at number 6. And you can see now United Kingdom number 17, and the Netherlands is number 9. Healthcare costs. This is about how much you would pay toward the medical system in place. So over in Spain and the UK, it would be free, because it's, well, depending if you choose to stay with the public healthcare insurance, or you would pay for a private one. That's your own decision, but you can stay with the free one. And then you have some countries where you need to pay because it's obligated to have a healthcare insurance, like in the United States. We all know within the entire world that the United States have a very, very, very high cost of insurance, and Germany is number 2 actually. And then you have over here the Netherlands, which is here 1, 2, 3, 4, 5, 6, 7, number 8. Something else, the best healthcare systems, and it's also included the United States. So in comparison, so the United States, they're paying a lot of money for healthcare to show if it's really that good or not. Well, over here you can see it clearly is not. So it doesn't matter how much you pay. It doesn't mean that that system is better than others. Over here, you will see that Norway is number 1. The Netherlands is number 2. UK, on the other hand, is over here at number 4. Yes, I know, Spain is not on this list. Okay, healthcare waiting times. How much do you have to wait? As you can see, there's some gray. This is gray. I've got no idea what that means. You have Australia. You have the Netherlands is over there as well, which means that the waiting time is not that long. It doesn't take away that you still need to wait. It's the same in Spain and the same I think in any country. And I think it really much depends as well on what you're waiting for. Are you waiting for a specialist? Are you waiting for an operation? Are you waiting at the emergency? So I think that really matters. Over here, healthcare insurance, healthcare systems within Europe. So you have the differences. It's basically explained in the same as this one. Spain, you're automatically included once you are registered as a resident, working, studying, or anything else. Mostly free, meaning that sometimes you have to pay a small fee. And small fee, I'm talking about 1 or 2 euros. It's really, really small. Over here, the Netherlands, this is all the information, but I can definitely remember the time that the government provided the information like, okay, listen up guys, we're going to kick out the public insurance, going to do that out, because we think that if we do everything private, all the insurance companies will have to compete with each other. And then when they're competing with each other, the prices will drop. Them would improve a lot because, you know, the insurance companies would have to compete. The system would get better and the prices would go down. And it immediately got more expensive. Like almost instantly got more expensive. And then they said, no, don't worry, it will drop. It will drop. It never dropped. Over here, a little bit more explanation how the system works in the Netherlands. So all the data and information that you might want to know about the Netherlands, how it works, when and how much it costs and for who it is, and etc. Just about everything you need to know. And over here from Spain, which is the same, all the information that you need to know, might want to know for when and how and what it costs and at what point, etc., etc. Over here, this is a fun site. I really like this site. You can just put any country that you like within these boxes. You can just change them up. You can even choose a city if you want to. Put these two together, Spain and the Netherlands. I put those two together, and to just compare them from skill and competency or medical staff. Well, they say in Spain it's very high in comparison to the Netherlands. The speed in completing the examinations, well, it's on both sides very high. Equipment, modern diagnosis and treatment, very high in both cases. Accuracy and filling out the reports and stuff is both very high. Friendliness and courtesy of the staff, well, this is personal, I guess. How much do you need to wait? Well, over in Spain, they say you have a little bit longer than in the Netherlands. Satisfaction, are you happy with how much you paid for all the medical treatment that you received in comparison to actually what you received? And over here, the Spain is very high. Well, it's mostly free. And is it close to where you live? Turkey, easily go to a doctor or to hospital. So this is a comparison. You can do that with any country, basically, in any city. The actual insurance, the actual private insurance, what does it cost for you? So within the Netherlands to have an insurance, I'm just going to, this is all Dutch, I know I need to have this one. A zorgverzekering means medical insurance. So I'm going to compare them. This is what it means to vergelijken, means compare. So I already filled in a little bit of the data and do a little bit of a comparison. I'm now going to talk about a man, which is 30 years old. Let's check it out, 30 years old. This I need to explain. So you have to pay your monthly insurance, which they calculate could be around this amount of money. But I have to explain this. What is going on here? So what they're saying that besides this amount that you need to pay every month, you need to pay this regardless. If you go to a doctor or not, if you go to a hospital or not, if you need medication or not, you're going to pay this regardless. You're going to pay this yes or yes. If you actually do go to a doctor, you need medication, you need treatment, the insurance will not kick in unless you first paid your part. So when you do not have that much to go around, when you do not have that much income, you might want to send it on the low side. But you could also say, well, listen, I don't have that much money. I don't have that much to go around. But, you know, I'm a 30-year-old, very healthy young man. I don't go to the doctor anyways. I don't get sick. So I'm just going to put it on this one. So my monthly cost will go down and I'll just take that risk. In case I get sick, okay, then I'm screwed. I just have to pay that 885 first before the insurance kicks in. But at least every month I get to pay a little bit less. So then that's a decision that you need to make for yourself. You got all those different extras over here that you can put on. And of course, anything extra, you need to pay extra. So there's something that you need to think about if you want to add that, yes or no. So let's just check without the extras, without anything, what will come out. So over here you see that this would be 107, this would be 108, this would 111. So as you can, there's just the different types of insurances. As you can see, it very relates to a car insurance. You need to check what you need for your car, how much you're going to use it, how many people will be in it. But now let's go back. Let's go and try it out for a family. So you go to insurances, again, same thing, but now I'm going to add. There you go. So we have now a family of 2 adults and 2 children. Again, you have to pick out your own part. Let's just continue with the children. Do not have any illnesses. You do not have any illness. You're all healthy. There's no diabetes, no other long-term illnesses going on, nothing like that. You're all very healthy and you hardly ever go to a doctor anyway. So you want to keep those costs as low as possible. So let's keep it indeed on those 885 to keep the costs as low as possible. So we're going to check that out. We're going to not go do anything extra. Dentist is free for the children until 18 years, and the rest you put in is just going to be extra. You're not going to do that. If you were to choose that, of course you can choose that, but in this case I'm not going to do that. As you can see now, the prices are 214. Why? Because it's 2 adults, so you have to pay twice the amount, because there's 2 adults. The children are free until they're 18. Now the big question. You have seen a little bit of the data, you have seen a little bit of the private packages, what they are about in the Netherlands, what they cost. If you were to live over there, you need to get health insurance in the Netherlands. Now the big question, is it really worth it for those people who do not have that much income to go around? The government does have support set up for help. For example, you have a minimum income and you need to pay the health insurance, and the government would say, okay, you have a minimum income, so we will support you for this part. If you have to pay like 120 euros a month on the healthcare, it might come up, or it might end up that you need to still pay for yourself 45, 50 or 60 euros yourself, and the rest will be done by the government to help you out because you have a low income. Yes, of course, they do that, but still, this is a cost that you need to pay every month. And if you fail to do so, you get fined, and those fines are really high. I've seen and heard from people that were really struggling to pay all those bills. Even though they got support from the government, they still struggled a lot to pay the bills. So you have to deal with that as well. So if you're going to implement a system that everybody in the country has to pay a private insurance, it also means that the people with the low income are forced to pay that. They are forced to do that as well. And those are the ones that are struggling every day to buy food. And looking at how England is doing, it's not bad at all. So is it worth it to change all that towards a system where everybody has to pay a private part? So this is all the information I can give you about this. My experience within the Netherlands, my experience over here in Spain, how it works. Do you think it's worth it? Is it really for the people that are working every day with a really low income, working many hours a day? And I've known for people over here in Spain working quite an amount of hours every day just to make sure that the children can go to school, they have everything that they need. And also within the stores and everything, that people just do not have the very high incomes. And they will be the ones that will be struggling to pay all those bills. For everybody to have a private insurance, knowing that those groups of people will have problems paying for that private insurance. The medical system in place is really not doing that bad. If you're looking at the numbers, is it not the case, in my opinion, that everybody must be able to see a doctor and go to a hospital when they get sick? You know, everybody, regardless if they have money or not, to make sure that they're okay, to take that risk that everybody needs to have a private insurance, that those groups of people are not able to afford that, and which means that they will not be going to a doctor because they do not have the money to pay for it, which means they get sick, which means they cannot work. You can see it really clearly just by looking at the United States. Everything that we know and that we actually joke about, from all the memes on the internet, literally going for a GoFundMe to please help them pay for the bills for medical reasons. Do you really want that for your country? Do you want that for your neighbor? Do you want that for your children? Because they might be in a situation that they're not going to have that much of an income. That's something that you might want to rethink. I'm not saying the Netherlands is doing bad. The Netherlands is really doing good. But also it's very expensive. In Spain and the UK it's free, but they're not that far behind of the Netherlands. Just let me know what you think, if it's really a lot better to have all privatized system, or to keep with the public system and let the people maybe choose for themselves if they want to have a private insurance or not? Let me know. Thank you.